Santa Clarita's hometown station, KHTS. That was Taylor Swift. And go to hometownstation.com for all the latest and greatest Santa Clarita has to offer. And speaking of the greatest Santa Clarita has to offer, we have a very special guest in studio from Henry Mayo Hospital here in the Santa Clarita Valley. We have Dr. Sevan Stepanian. Oh, man, I had it right before we went on, and then it just got into my head.
That's okay. That was pretty good.
That's what happened.
Yeah.
Hey, Doc, how are you?
Good. Thank you. Thanks for the introduction. Appreciate it.
And you are a urologist that is trained in robotic assisted surgery.
Correct.
I want to start with this, and I asked you this during the break, but what was it about urology that stuck out to you? When you were doing your wait, hang on, I remember what it was called, rotations.
Rotations,
right?
exactly.
That's when you
during med
decide,
school,
right?
Sure.
Yeah. Okay. So what was it?
It's like the sorting hat of med school, I guess. No, I mean, for me, urology was great because it's a surgical field, first and foremost, and I really loved surgery, so that's what I wanted to do first. But it's also a field that incorporates a lot of technology, and it tends to sort of disseminate out from urology and other fields, and so we get to play with a lot of toys and have fun, so I like it that.
And so you went to med school, you got your degree in urology? What is it called? Like you went to med school.
Yeah, you get your medical degree.
Okay.
And then you decide what you're going to specialize in, and then you do residency in that field.
There you go. So you did your residency, and then you went off. You were telling me you did like a robot school.
Yeah. So then I was like a glutton for punishment, and did even more. And then I went to Seattle for a year. So residency was 6 years after 4 years of medical school, and then in Seattle for a year to learn or sort of subspecialize in robotics.
Okay.
Yeah.
And what was that experience like?
Oh, it was great. It was fantastic. Yeah, it's a really, really high volume program there, and it was just me one-on-one with a really high volume surgeon there, Jim Porter, just doing up to 10 robotic cases a week. It was great.
And I have to ask this: did you ever get to Pike's Place and have their clam chowder?
I did.
Oh man,
I did.
So good up there.
Great.
So good up there. Anyway, you're a SoCal guy though.
I am.
Born and raised here.
Yeah, Granada Hills.
Granada Hills, UCLA for your undergrad and your med school.
Yep.
I hear they have a pretty good med school over there at UCLA.
Yeah, they're decent.
Not bad. Okay, so but one exciting thing about this, you're a robotic assisted surgeon. You did urology, but it's that type of thing is here in the Santa Clarita Valley. It's available to us.
Right. It's great. I mean, I think it was a long time coming. And for a lot of years, we were losing patients out of the community to different hospitals where the robot was, and this type, certain types of surgeries were offered that we just didn't have here.
Yeah.
And now we've not only have the technology, but we have surgeons that are really well trained and know how to use the technology, so we can offer it to the patients here. Patients don't need to go anywhere for their care. It's great. And
so this is a community that's like I don't know. I've never been to another community like it where there's big Los Angeles just south of us, 40 minutes or 4 hours depending on traffic. And it's just south of us, but we're kind of our own little community. Those mountains at the Newhall Pass kind of block us away from the big bad Los Angeles. And but here in the community, we like to stay in the community, and so this is a big thing for the Santa Clarita Valley.
Yeah, and it's nice to have physicians that are well trained on the technology because you want to be taken care of sort of from point A to Z, right? You don't want to leave the community and get taken care of, then get handed off to somebody else. And so you can really get the complete care locally and, all aspects of care, surgery, oncology. We just have a lot of great new physicians here, and the hospital's really making an effort to bring a lot of new technology to the people here, and it's great.
Yeah. So this is an exciting thing. So, I mean, this means, you don't have to go anywhere. You can stay here. And, there moments where, of course, you're like, it's not that big a deal. I'll get healthy if I just drive so-and-so. But, that drive back and the having to go there multiple times, it can wear on you.
Yeah, and it's an inconvenience. And sometimes it's a safety issue. I mean, you want to have access to your physician, right? I mean, if you're at home and your physician's 5 minutes away, there's a sense of comfort in that, as opposed to having, at an academic center, a resident who may see you, and you may not really have access to your physician all the time.
When you did your robot, we're speaking with Dr. Sevan Stepanian. I just did it again. Dr. Sevan Stepanian, he's a urologist, and he is trained in the robotic assisted surgery, which is now available. It is the Vinci Surgical System, and it is. What are the benefits of having this type of, not necessarily just having it here, but what are the benefits of robotic surgery just in general?
Sure. So it's really a means for us to be able to do laparoscopic or minimally invasive surgery.
Okay.
So we can do surgery with small incisions as opposed to having to make a bigger incision. But the robot itself allows us to do what I think is a better surgery. So a more precise surgery, less bleeding, oftentimes better sort of surgical outcomes, and then oftentimes better outcomes on the back end too in terms of recovery, getting patients out of the hospital sooner, getting patients back on their feet faster, getting patients back to work faster, and sort of getting them over whatever that disease was that they were initially dealing with and back on, back to their normal life, which I think is a huge sort of game changer for us.
How does it work? Like, do you have your hands in like a machine and you're doing it and it's just following your lead, or do you like type in data? How does this whole robotics thing work?
Yeah, so really it's just a puppet. I mean, it won't do anything until you actually input something. So there's a console that the surgeon sits in that's, about 6-7 feet away from the patient. And then on the patient itself, the robot will dock to the patient.
Okay.
And then the surgeon, will control the robot from that console. So they're essentially handsets that our hands go into, and then our wrist movements are mimicked within tiny little instruments that are inside the body.
Gosh, that's
so
gnarly.
It's pretty amazing.
That's cool.
It's great. It's great.
And that's why you got into medicine.
It's a lot of fun.
Because of stuff like that.
Yeah.
Doc, thanks for coming in, man. I appreciate you being
Of
here.
course.
You can go to the Henry Mayo's website, and there is a robotics section on there, right?
Yeah.
Yeah. So go check that out as well. Doc, again, thanks for coming in. Appreciate you being here.
Thanks a lot, Kyle. Appreciate it.
Santa Clarita's Hometown Station. Learn more at hometownstation.com.
Your hometown station.